going to show you how to do CPR and then transfer to AED use. Here's the situation.
Lydia was on her way to class when all of a sudden she tripped. Oh no, she fell!
So this is what you would do in this situation. First, you want to check the scene to make sure it's okay. The scene is safe. And then you want to come to Lydia and you want to check for consciousness. So you would do that by asking a question. Lydia, are you okay? Are you okay? She doesn't respond. Call 911. This is how you check for breathing. You look, listen, and feel for 10 seconds. You listen. Okay, you do the head and tilt, 2 fingers underneath, 1 hand on the forehead and tilt and look. And you listen with your ear above their nose. You feel with your cheek for air coming out of their mouth and nose, and you look at the chest. So I'm gonna do this for 10 seconds. 1,000, 2,000, 3,000, 4,000, 5,000, 6,000, 7,000, 8,000, 9,000, 10,000. Lydia's not breathing, so now we move to CPR. There's 2 components in CPR, rescue breaths and chest compressions. Since Lydia is over 12 years old, which classifies her as an adult in first aid world, you start with chest compressions. Chest compressions should be done with 30 per cycle and have 100 per minute. So for chest compressions, you take 2 hands. 1 hand on the chest with the fingers risen off the chest. The other hand laced through the other hand, arms locked, and you press at least 2 inches 30 times. So you would go 1, 2, 3, 4, 5, 6, okay, continue. So now we move to the rescue breaths. We do 2 rescue breaths. The first thing you want to do is open the airway. Use 2 fingers and tilt the head back, and use the other hand and put it on the forehead. So you head tilt, chin lift. And then you want to do 2 rescue breaths by making a complete seal over the mouth and closing the nose with the same hand that's on the forehead. You not breathe anymore, and then you let go of the nose so their air can come out, and then do another one. Then you do the same. And then you repeat the 30 chest compressions and then 2 rescue breaths until emergency personnel arrives, until you are too tired to continue, the scene becomes unsafe, or they regain consciousness. Or an AED becomes available.
An AED has become available. This will be used to reset the patient's heart. First, you're going to turn it on.
This is a training device only. No shock will be delivered.
And follow the instructions. What it's going to tell you to do is first rip all the clothing off the patient's body and shave any hair that's in the area which the pads will be placed on their body, and they'll have a shaver sometimes. Make sure that there's no water on it, because that can be very damaging to the patient because it's a shock. And then it's going to tell you to take the pads out and put them on the patient's body as shown. And make sure you have it plugged in. And then it'll tell you that it's about to the shock and to stay away. So make sure you stay away and tell anybody who's nearby to not be touching the patient at that time, because they could get shocked. With children, sometimes their bodies are so small that you're going to have to put 1 pad with these smaller version on the front and on the back, because you don't want them to be touching, because that can be damaging when it gives a shock. So you'll put 1 on the chest and 1 on the back. Another important thing to remember is that when you call 911, you want to make sure to stay at least 6 feet away from the patient, because it could interfere, the cell phone could interfere with the shock that's being given.
Everyone stand clear. Push the shock button. Shock delivered. Begin 5 cycles of CPR.
Make sure you follow the directions that you do the CPR, and sometimes like even with some AEDs it'll have the beat that you can go to. And so just do CPR as previously shown until it tells you to stop, so if you have another shock. And during this whole time, make sure not to turn off the AED, because it'll keep checking the rhythm of the heart to see if another shock is. Make sure you keep the pads on so it can keep checking and evaluating the heart.
Now we're going to show you what to do when a person is choking, both conscious and unconscious. Oh no, Lydia, okay, somebody call 911, Lydia's choking. Okay, keep coughing, you're doing, oh no. Now, putting my hand over between the shoulder blades. Then bringing her back up, I find her belly button and navel, and putting one hand over the other and using my thumb, I push in and up. Ready? 1, 2, 3, 4, 5. Yay! And you continue this method until the foreign object, or whatever is inside blocking the airway, comes out, or...
Now we're going to show you what to do when somebody is unconsciously choking.
I'm eating a carrot. Uh-oh.
The scene is safe.
Ma'am? Sir, ma'am? Or ma'am? Are you okay? Ma'am, are you alright? Somebody call 911. You. And now, we look, listen, and feel for breathing by doing the head tilt chin lift technique while staring at the chest for 10 seconds. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, 6 Mississippi, 7 Mississippi, 8 Mississippi, 9 Mississippi, 10 Mississippi. Okay, this person is not breathing. I do not hear any breathing, so now I'm going to go and deliver 2 rescue breaths. For this, we use the head tilt chin lift technique. The chest did not rise, so now we give a 3rd rescue breath just to make sure and retilt. Okay, so the chest did not rise. So now we are for sure certain that there's something blocking the air. We have to go and carry on and do 30 chest compressions. Right at the sternum, and put your elbows locked, and then right over the person's chest. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 23, 24, 25, 26, 27, 28, 29, 30. You did 30 chest compressions. Now make sure that you get 100 in about a minute, and you go at a very good time of pace. Now we go back, and we open up the mouth and check again to see if we can see any foreign objects inside the mouth. If you see the object, reach in there and try to pull it out. Okay, there's no object. So now I go and deliver 2 rescue breaths again. Remember, while delivering the rescue breaths, remember to stare at the chest. And now I go back and I deliver 30 compressions. Okay, now we go back and we check the mouth again. And here's the carrot. The person has now started to breathe again. Thank you for joining us, ladies and gentlemen.